With your NCLEX review question of the day. A nurse is providing education to a patient recently diagnosed with peripheral arterial disease. Which of the following statements, if made by the patient, indicates a need for further teaching? So our keywords here is peripheral arterial disease. Whenever we go to review our answer options, we're going to look for the wrong answer or an incorrect statement, because remember, we're looking for a statement that indicates a need for further teaching. So as always, before we move on to the answer options, what do we know about peripheral arterial disease? Now, peripheral arterial disease is very broad, but just kind of brainstorming, what do we know about it? So we know that, it's a chronic disorder in which there is arterial occlusion that deprives the lower extremities of oxygen and nutrients. So the patient with peripheral arterial disease is going to have intermittent claudication. So it's going to be pain in the muscles of the lower extremities as a result of that inadequate blood supply. They're going to have oftentimes they will have pain in the lower extremities at rest. It may be characterized as a numbness, a burning, or an aching. They may also have loss of hair on the lower extremities, very dry skin. Whenever we're thinking about interventions or patient education in a patient with peripheral arterial disease, it's very important to know those interventions that you need to teach them. So one of them is you want to tell the patient, avoid crossing the legs. So whenever they cross their legs, it can interfere with the already limited blood flow to the lower extremities. Also, you want to educate the patient on the importance of avoiding exposure to really cold temperatures, because the cold temperatures can cause vasoconstriction, therefore reducing blood flow to an already reduced blood flow area. You also want to tell the patient never to apply any heating pads or direct heat to the lower extremities, because they're going to have decreased sensitivity in the lower extremities, and so any sort of heat application may cause burns. Kind of thinking about all of that, like I said, peripheral arterial disease is very broad, but those are some of the things that we know. So now whenever we get back to our question, we are looking for a statement that indicates a need for further teaching. So A, I will avoid crossing my legs when sitting. We know that this is true. We want them to avoid crossing their legs so that it doesn't reduce the blood flow to the legs. So we can eliminate A. B, I will elevate my feet above the level of my heart when sitting. Okay, this is a tricky one. So in a patient with peripheral arterial disease, you want them to elevate their feet at rest, but you do not want them to elevate them above the level of the heart, because when you think about it, that extreme elevation will further slow arterial blood flow to the feet. So while you want them elevated, you don't want them elevated above the level of the heart. So B is wrong. So B is going to likely be our correct answer, but let's move on just to make sure. C, I will wear thick socks and insulated shoes for warmth when it is cold outside. Yes, that's true. You want them to protect the lower extremities from cold temperatures, because remember, those cold temperatures can cause vasoconstriction. So we can eliminate C. And D, I will avoid use of heating pads and hot water. True. Remember, the patient is going to have decreased sensation, so the use of heat may lead to burns. So we know that A, C, and D are true, which means they are not our correct answers. B, I will elevate my feet above the level of my heart when sitting, indicates a need for further teaching, and therefore is our correct answer.